What is colon cancer? Colon colorectal. Cancer starts in your colon, large intestine, the long tube that helps carry digested food to your rectum and out of your body. Colon cancer develops from certain polyps or growths in the inner lining of your colon. Healthcare providers have screening tests that detect precancerous polyps before they can become cancerous tumors. Colon cancer that's not detected or treated may spread to other areas of your body. Fewer people are dying from colon cancer thanks to screening tests, early treatment, and new kinds of treatment. Subscribe to our channel and click on the notification bell to be the first to receive new content. An opportunity not to be missed to enhance yourselves and improve the quality of your lives. Let's together build a healthy and vibrant community. How does this condition affect people? Your colon wall is made of layers of mucous membrane, tissue, and muscle. Colon cancer starts in your mucosa, the innermost lining of your colon. It consists of cells that make and release mucus and other fluids. If these cells mutate or change, they may create a colon polyp. Over time, colon polyps may become cancerous. It usually takes about 10 years for cancer to form in a colon polyp. Left undetected and untreated, the cancer works its way through a layer of tissue, muscle, and the outer layer of your colon. Colon cancer may also spread to other parts of your body via your lymph nodes or your blood vessels. What are the signs and symptoms of colorectal cancer? A change in bowel habits, such as diarrhea, constipation, or narrowing of the stool that lasts for more than a few days. A feeling that you need to have a bowel movement that is not relieved by having one. Rectal bleeding with bright red blood in the stool, which might make it look dark. Brown or black, cramping or abdominal. Belly, pain, weakness, and fatigue, losing weight without trying it. Colorectal cancer might not cause symptoms right away. Many of symptoms of colorectal cancer can also be caused by other problems, such as infection, hemorrhoids, irritable bowel syndrome, or inflammatory bowel disease. It's important to get checked if you have any of the following problems. In many cases, people who have these symptoms do not have cancer, but you should talk to your doctor if you have any of them so the cause can be found and treated. Often, colorectal cancer doesn't cause symptoms until it has grown or spread. That's why it's best to be tested for colorectal cancer before having any symptoms. Colorectal cancer found early through screening before you have symptoms might be easier to treat. Screening can even prevent some colorectal cancers by finding and removing precancerous growths called polyps. How does the doctor know if it's cancer? If you have symptoms that might be caused by colorectal cancer, or if a screening test shows something not normal, your doctor will want to do more testing to find the cause. Your doctor will ask about your medical history to learn about possible risk factors, including check for symptoms, and it's important to know your family history. You will also be asked if you're having any symptoms, and if so, when they started and how long you've had them. You might be able to have a virtual visit to talk with your doctor about symptoms or risk factors that might be worrying you. But depending on your symptoms, your doctor might want you to schedule an in-person visit so you can be examined. As part of a physical exam, your doctor will carefully feel your abdomen for masses or enlarged organs and also examine the rest of your body. You may also have a digital rectal exam. During this test, the doctor inserts a lubricated, gloved finger into your rectum to feel for any abnormal areas. Your doctor may also want you to get more tests such as colonoscopy. A colonoscopy is a test where a thin tube with a light on the end is put through the anus into the rectum and colon to look closely at the inside. If any abnormal lump, mass, or growth, polyp, was found, a piece of it can be taken, a biopsy, and checked in the lab for cancer cells. Biopsy. During a biopsy, the doctor takes out a small piece of tissue where the cancer might be. The tissue is checked for cancer cells. This is the best way to know if you have cancer. CT or CAT scan. A CT scan is like an X-ray, but the pictures of your insides are more detailed. CT scans can also be used to help do a biopsy and can show if the cancer has spread. Ultrasound. For this test, a small wand is moved around on your skin. It gives off sound waves and picks up the echoes as they bounce off tissues. The echoes are made into a picture on a computer screen. It's used to help find cancer and see if it has spread. Other tests, such as MR scans, X-rays, and blood tests, may also be done to look at how big the cancer is and whether it has spread. Thanks for watching our video. If you found it useful, don't forget to subscribe to our channel for more informative content.